Welcome to the first General Practice Solutions podcast. I'm here with Jenny Swan, who is our workflow optimization lead, and we are going through patient recall today. Can you let us know, what is patient recall?
Hi Ella, thanks ever so much for having me on the call. So you're right, today we're going to be going through recalls. Now, recalls are covered in primary care under the National Patient Recall Framework. So this refers to when a patient is invited back for a follow-up appointment, screening or a review. This is typically done for things like long-term condition reviews, so diabetes, asthma, hypertension, COPD, medication reviews, so patients on repeat prescriptions, high-risk medications like blood thinners and antidepressants, health screening, so smears, NHS health checks, vaccinations, immunisations, things like flu jabs, your childhood vaccinations, shingles, pneumonia, COVID boosters, test results and follow-ups, and your annual reviews for vulnerable patients, so patients with learning disabilities, mental health conditions, or those on specific registered, for example, frailty. They all might be invited back for health checks.
Wow, so a lot's covered in that. So how can you make that work for each practice, and can you take it off their hands completely?
Yeah, absolutely. So General Practice Solutions offer a recall service. We use a platform which is designed to automate patient recall processes. So this tool can significantly reduce administrative workload by identifying the patient's care needs against their profile and managing the invitation process. So it automates patient messages, tracks responses, provides dashboards to monitor that progress. So a lot of it is automated. However, we do also have a manual oversight for things that are non-responders or complex cases. So it can massively enhance efficiency and improve patient care in the practices.
Brilliant. So in primary care, QoF is very important. So can recall help with that?
Absolutely. So recalls can significantly help the GP practice or primary care organisation meet quality and outcomes framework, so your QoF targets. So this is by ensuring patients receive timely reviews, screenings, invitations. So how we can do that is our recall service will be able to identify things like diabetic patients having HbA1c checks, foot screenings, blood pressure checks, hypertension patients to come in for annual blood pressure monitoring, booking the asthma and COPD reviews. Now, this can be for spirometry, inhaler technique checks, things like this. It covers everything that I said before, so health screening and prevention, so cervical smears, NHS health checks, flu vaccinations, medical reviews and safety, so annual medical reviews for long-term or high-risk medications, monitoring blood tests, and mental health and learning disabilities. Now, all of those are covered under the quality and outcomes framework targets. So by ensuring that the recalls are done, this means that your QoF indicators are met much more efficiently. Now, what we can do for you on this is we will reduce your manual work, so your administrative work, by automatically sending out SMS messages, calls, letters. We actually reduce the did not attends because the timely reminders can help patients attend their appointments. We offer a full coverage, so no patients slip through the cracks. So we can maximise those QoF points for you. And essentially, it frees up the clinicians and the administrative time so that you can focus more on patient care rather than chasing appointments. You know, obviously, those non-attenders as well. We can take everything off your hand.
Brilliant. So you mentioned patient care, so I assume this is a big positive for all general practice to use when it comes to caring for patients.
So patient care is one of the most important things in primary care, and by ensuring that your recall process is completely taken care of, this means that there's timely follow-ups, better disease management and increased accessibility. So we can do things like better screening uptake. So all of these screenings that need to be checked, we will ensure that each patient that needs to be recalled is recalled in a timely manner. So having a recall service to manage all of your recall processes, it does increase patient attendance, it improves disease prevention, it reduces the administrative burden and enhances overall health outcomes. Obviously, everything that we do focuses very highly on patient care and ensuring that that patient is receiving the best care possible.
Well, it sounds like a no-brainer, Jenny. Thank you for joining us for our first podcast, and we'll see you all soon.
Thank you very much, Ella. Bye.